hospitals literally ran out of beds. So it is quite challenging to really claim what if we know actual long-term consequences. We may not know it. So whatever I say reflects on what we could have found as a result of the first year of the pandemic in Kyrgyzstan. But before we address these questions, I would like to briefly kind of digress from the COVID topic. The report was provided or prepared with two distinct audiences in mind. First group was those who interested in Kyrgyzstan, and particularly on how the pandemic developed, kind of contextualize what kind of country Kyrgyzstan is so that we better understand the context. But before that, very briefly, what sort of situation we have and do not know Kyrgyzstan very well, I have to just provide a couple of observations. First, Kyrgyzstan is a small Central Asian state, of course, and bordering with China and formerly part of the Soviet Union. This is important for us to understand the kind of state institutions that this country has that have been tasked to address the pandemic crisis. Kyrgyzstan's economy is very weak. It is not only small, but weak, heavily dependent on remittances from labor migrants, mostly in Russia, and export of gold, and also dependent on loans and grants from outside the country. Politically, Kyrgyzstan is, I think, quite well known as a regime fluctuating between a weak democracy and weak authoritarian regime. It has been called an island of democracy in Central Asia in the past decades, particularly middle of 90s. The elections are conducted more or less regularly. However, never in Kyrgyzstan opposition came to power through elections. We had 3 instances of regime transition, and all of them happened after the street protests, the latest being October 2020, in the middle of the pandemic. The country suffers from a high level of corruption, particularly in the high government offices. This is a well-known problem, and every new president of Kyrgyzstan starts his business acknowledging this as a problem. However, we have seen little progress in this. These are, of course, very gross simplifications, but I think it is good to understand how Kyrgyzstan as a country, with its political history, with its geography and economy, is very different from other countries, particularly in this series, some including China or South Korea or Mongolia. These are very, very distinct countries, although we are all in part of the bigger region of Asia. The COVID-19, the pandemic, came to Kyrgyzstan relatively late, but it has hit quite hardly. On the one hand, of course, we have to acknowledge that it is quite challenging and maybe not even an accurate task for us to try to compare whether Kyrgyzstan was struck harder or not that harder. It is difficult to compare countries for a variety of reasons. But to give a picture, these are the statistics of the COVID-19 as of today. It is, of course, hard to make sense unless you know the Kyrgyzstan's population, which is about 6.5 million and so on. But to provide greater context, we could compare this to the deaths out of the COVID pandemic to total excess deaths. The excess death is a notion that relates to, that helps us to understand the true scale of the damage that we see after, because of the COVID-19. In blue, the figures are the official recorded figures of deaths from COVID. And in red, we have the figures for excess deaths. Excess deaths for 2020 is basically the number of deaths that is occurred on top of the average number of deaths we would normally have. So in Kyrgyzstan's case, compared to the average number of tests for past 5 years, we had extra 8,400 deaths, out of which only 1,400 are accounted for COVID, and we don't have proper explanation for the remaining 7,000 deaths. And of course, this figure can help us to understand the true scale of the COVID damage. And it also demonstrates that since we didn't have other major disasters like earthquakes or other problems that would cause major spike in deaths, we can claim that directly or indirectly, the pandemic is accountable for the remaining deaths as well. Some of them could be COVID cases that were not qualified or not defined as COVID, and others could be deaths from other reasons, but caused by COVID in a sense that the patients could not properly receive advice or medical help, with hospitals being overpacked and without any beds and so on. The discrepancy between the excess deaths and the reported COVID deaths is quite important. And this chart comes from The Economist, which demonstrates that how large discrepancy is. The colored part are the deaths accounted for COVID formally, officially, and the line is the monthly fluctuation of the excess deaths. You see that in all 3 countries of this region, excess deaths really doesn't overlap with the COVID reports. Compare this to several European countries where excess deaths, as it grows up and as it goes down, has been very much going together with the reported COVID casualties, which kind of gives us a warning that we cannot really have reliable data to assess the real scope of the problem. And finally, this economic impact. Another damage of the COVID was the shrinking contraction of the economy. So in Kyrgyzstan, we have the steepest decline, nearly 8% of the negative growth of the economy for 2020. And just for the comparison, the figures for other countries of the region have been quite different. I will stop slides here and just move with my face directly facing you. I hope that we can establish more or less kind of eye contact. I'll be looking at the camera more now. Now, the figures that I demonstrated basically show that Kyrgyzstan has been hit hard, just like many other countries. But now the question for us is, what was the government of Kyrgyzstan's biggest challenge as we faced the crisis? And here I would like to, of course, acknowledge that the COVID-19 and the pandemic has been a kind of all-embracing problem, stressing every single policy area, from education to healthcare to taxation to international relations. But there are 3 problems that we could focus on for now. First, the government had a challenge of containing the spread of the virus. So the first problem that government had was how to minimize the spread of the coronavirus among the population. Second, providing medical support for those who already contracted infection. That basically treating the patients. And the third, the task was alleviating economic damage, which was a result of the lockdown and other pandemic measures. Containment was, of course, the first in the chronologically. As soon as the news from China came about the new virus and countries started kind of lockdown processes, Kyrgyzstan was not an exception. The initial efforts included travel suspension from China. Although we have to also acknowledge that despite bordering with China, Kyrgyzstan was quite lucky in terms of receiving the first cases of coronavirus quite late. only on 18th of March, as far as I remember, we had registered the first cases of coronavirus. And those were, of course, not coming from China, but from Saudi Arabia, the people who went to pilgrimage and they were returning. So they were the first patients with registered coronavirus. As soon as the two cases emerged, the government dramatically stepped up the containment measures. And by end of March, Kyrgyzstan went into a very strict version of lockdown, with schools moving to unplanned spring breaks, longer spring breaks, and later switching to online mode throughout the country. The businesses were shut down, particularly in Bishkek, the biggest city, the business center of the country, was faced very severe version of lockdown, with everyone ordered staying at home. And the emergency situation was declared, with the police and even military given the emergency powers. However, in the Kyrgyz case, with the relatively weak economy, we could not afford too long period of the lockdown. So in May and early June, the lockdown measures were relaxed, and almost completely lifted towards the summer, which then led to a huge spike of the new cases, which we saw, I think, in the charts. So we had so-called Black July, where just exactly a year ago from now, in Bishkek, the hospitals ran out of capacity. People with video footage and photos demonstrating how people were little dying, unable to enter the building of the hospitals. So the containment measures was that, and it basically lasted for several weeks in the spring. Second problem, of course, the treating patients. As we receive growing number of patients already with confirmed coronavirus, what we do, there was nothing, of course, here novel to invent from the Kyrgyz government. No country in the world had and still has effective drugs against the coronavirus. And of course, we didn't have vaccine back then. So the only thing we could do, the government could do, is to accept the hospitalized people with severe symptoms of the coronavirus and help with alleviating the symptoms. The task proved to be very difficult for Kyrgyzstan's government, as hospitals ran out of beds and workforce. Several daytime infusion sites were opened throughout Bishkek, just for patients to arrive during the day, receive some injections and some advice from doctors, and go home again. Finally, the economic damage. That was the biggest problem. What government did was declare that taxes would be suspended or deferred. Later, the government set up the anti-crisis fund to provide concessional lending to local businesses. But of course, there was nothing comparable to measures we see in more developed countries, where households and local businesses received one-time or two-time payments from the government to support or to compensate the losses incurred because of the lockdown. Kyrgyzstan, having literally empty budget, could not afford providing help of that sort. So the only thing we could do is pay taxes later or receive concessional loans. There were, of course, these policy measures revealed big issues in Kyrgyzstan. Nearly none of them worked very well. And I already mentioned the shortage of beds. That was the biggest problem. The public healthcare system was stressed and brought to its limits in many ways, not only in terms of beds or buildings, but also in terms of the workforce. In the study of the Kyrgyzstan's case, I consulted with several doctors who directly worked in so-called red zones, the parts of the hospital directly treating the COVID patients. And they were telling stories that the equipment, medications were lacking, but more also several hospitals were packed by doctors whose specialization was very different, which resulted in the fact that application of medical protocols was not consistent across different hospitals or clinics or so-called observation sites, with surgeons or orthopedicians, different doctors, all involved in providing treatment for COVID. That was kind of revealed the failure of the government to prepare in advance during the lockdown period to prepare the sufficient number of trained medical force and buildings of the new hospitals. Only in July, the government announced construction of new hospitals in Bishkek and second largest city, Osh, but that was a measure too little and too late, only after the period when the surge of July started slowing down. There are two other issues with the society. All of the previous topics were about the government and government measures, but we should also acknowledge that a big problem was the way how the society responded to the new crisis. On the one hand, and bad news, was that in Kyrgyzstan, just like in many other countries, there was a huge degree of distrust or denial of COVID. People simply dismissing the importance of the subject, importance of the illness. Plus, and probably even more important, was the prominence of disregard for COVID in the society. Although the government lacked resources to enforce very strict lockdown, so it had to relax the measures, the people basically went free with daily communication, with kind of phenomenon called toys in Kyrgyzstan, with family celebrations, family gatherings, reunions, and with government having little resource to enforce the social distancing and other restrictive measures. The societal processes, I think, led to dramatic growth of infections in those summer months. At the same time, as the government faced this emergency, it was the society, particularly volunteers and civil society, that came as a rescue force to help the government, to help the public healthcare system to face this problem. So as governments ran out of money, ran out of resources, the fundraising and to support, to provide the food package to the most vulnerable people, to buy equipment or to buy medications for hospitals, were all organized very much by civil society activists in Kyrgyzstan. At a later stage, when we had the so-called Black July, the most toughest period of the pandemic, the volunteers, young students or recent graduates of medical institutions went to provide logistical support to doctors in observation sites. So it was very impressive demonstration of the societal solidarity in the time of emergency. Some argue that this kind of phenomenon reflects the state's failure to provide basic services. So when there is no public institution, then it is up to the society to compensate and to deliver the service. Some argue that this is more of a cultural, historical phenomena, because Kyrgyz people mostly living in the nomadic societies without state institution for most of the past centuries. There is this culture of mutual help during the emergencies. Whatever is that, we have to acknowledge that the community response was critically important for overcoming the most difficult period of the pandemic. Now, so in economic aspects, in medical aspects, and in terms of containing the spread of the virus,
So the governments took some measures, mostly half-hearted and half-successful, mostly failing. And this gives us an opportunity to think kind of more broadly and to think what were the conditions that enabled such not so good results in Kyrgyzstan, and what are the implications for the longer term. Here, I would like to focus on three areas, possibly. First is the state of economy. The Kyrgyzstan being a weak economy, not only as an economy as a whole, but also weak, very small fiscal space of the government, when the government doesn't have much money in its disposal to support. That was very hugely important. The economy contracted as a result of the pandemic, with poverty levels going up from 20% to 31% according to the World Bank. So 10% of the population shifted from non-poor people to poor category into the poverty. Of course, the causes were lying in the existential dependence of Kyrgyzstan on several sources of the support for the economy. One is the trade and travel. The pandemic disrupted travel, disrupted trade. And Kyrgyzstan, being heavily import-oriented or import-dependent country, was one of the early and biggest victims of this suspension of trade. Second, the shutdown of local businesses was very hurting, and this is probably hardly comparable to the similar shutdowns in developed economies. In Kyrgyzstan, particularly in Bishkek, a huge chunks of economy is run by people on a daily wage. Those who consume money that they earn on that day, from people working in bazaars, in markets, taxi drivers, and so on. So since the lockdown for a couple of months meant they had to stay at home with literally no savings, that process, that kind of event exposed the pre-existing problem, pre-COVID problem of Kyrgyzstan, the lack of very healthy functioning economy. Finally, the remittances. Kyrgyzstan is routinely among the top 3 or top 5 countries in the world in terms of the dependence of the economy on remittances, that is, money transfers from outside the country. As pandemic hit other countries, including Russia and Kazakhstan, the primary sources of remittance for Kyrgyzstan, initial periods of the pandemic meant that households stopped receiving the same amount of money from their family members working in Russia and in Kazakhstan, which of course contributed to shift from non-poor state to poverty of many households, in particular rural areas of Kyrgyzstan. At a broader level, this dependence demonstrated the degree of fragility of the Kyrgyz economy, dependence on outside sources of money, of capital, plus it exposed the precariousness of the vulnerable groups. The pandemic demonstrated how youth or women ended up being among the categories most affected by the lockdown measures and by other economic implications of the pandemic. There are several studies already conducted in Kyrgyzstan which demonstrate that even the particular industries that were hit heavily were the ones employing mostly women, mostly uneducated, kind of unqualified, poorly qualified workforce, already vulnerable groups, and they were hit hardest. Politically, the pandemic year was very eventful. I tried to calculate the number of healthcare ministers. So for the first year of the pandemic, Kyrgyzstan had 3 health ministers kind of replaced each other, 4 prime ministers, 3 deputy prime ministers overseeing the pandemic, 2 presidents. That is, the 2 presidents is about the regime turnover in October, when President Shairbek was overthrown as a result of street protests. But the change of ministers was also a result of the instability within the government, which to great extent reflected the lowering trust of the public on the state and on how the state was addressing the problem, addressing the crisis. Indeed, if we think of the reasons how October Revolution, so-called October Revolution, happened, of course, there were other problems like corruption and the political mobilization of opposition and so on. It is undeniable fact that the sitting government's failure to convince the public that it did its job well in terms of fighting pandemic contributed very much. First, of course, the economic implications of the pandemic didn't make the government very popular. Second, there were numerous reports of corruption and embezzlement of the COVID-related resources by officials, by high-level officials. And as far as I remember, one of the former healthcare ministers and one of the former prime ministers are arrested and detained now precisely on charge related to use of distribution of the pandemic-related resources. So in terms of the politics, we could summarize that the pandemic kind of exposed the low level of trust of the public in the state institutions, and the new government that we have since October will have huge headache in terms of how to fix or how to rebuild that public trust. Finally, in terms of international relations, one would think that foreign policy or IR isn't really directly related to coronavirus or the pandemic. However, in case of Kyrgyzstan, I think a couple of points could be made in terms of the consequences of the COVID-19 on Kyrgyzstan's international relations. First, of course, the pandemic demonstrated the degree to which Kyrgyzstan is dependent externally. Even before the first cases of COVID emerged in Kyrgyzstan, the government started actively fundraising outside the country. Kyrgyzstan was among the first, I think it was even the first country to receive the IMF's emergency aid to support the government measures to deal with the pandemic. Other pleas were included requests for China and other governments to suspend the payment of the debts so that we could focus on domestic issues. Now, currently, in terms of vaccinations, Kyrgyzstan is already demonstrating the degree to which we are dependent on outside help without being able to procure vaccines ourselves. Basically, the government is dependent, basically waiting for Russian, for Chinese vaccines, most of them for free. The government wasn't able to not only procure the vaccines, but also to convince the population to get vaccinated. As of now, Kyrgyzstan's vaccinated population includes, I think, 1.5% of the population, so very low. And second, of course, the pandemic didn't only expose the dependence of Kyrgyzstan, but also exacerbated the dependence. If before the pandemic, Kyrgyzstan could be called as a routinely asking hand or beggar in terms of requesting for credits and grants at the global level, after the pandemic, it became clear that even within the regional scale, within the Central Asian context, Kyrgyzstan became acknowledged as the weakest link with Kazakhstan and Uzbekistan, demonstrating that they are willing to provide humanitarian aid to Kyrgyzstan, construct buildings of hospitals for us, provide medications, and so on. So basically, if before the COVID, Kyrgyzstan within the Central Asia was just one of other Central Asian states, as a result of the pandemic, I think the image or reputation of Kyrgyzstan as weak and dependent and vulnerable got really established even at the regional level. To conclude, to leave some time for questions, we can say that indeed the pandemic proved to be a severe stress test for the whole entire state system in Kyrgyzstan. It revealed the fragility of the economy, and other than that, poor policy decisions, corruption, and low level of public trust in the state institutions contributed to different aspects of the challenge that society faced with the pandemic. At the same time, we do see the resilience of the society in terms of how it reacted to the emergency situation. And as the new government is trying to fix the problems or trying to find new approach, several things, kind of 3 points could be highlighted as the priorities for it. First, the government must do everything possible to restore the trust of the population in the public institutions and the state. People should start trusting the healthcare minister's statements, or to doctors, or to economy ministry. So the whole impression that the state abandoned the population, abandoned local business, must be somehow reverted so that the government measures are implemented and enforced and the population supports the government. That was lost, and that is going to be a very difficult task to address. Second, the new government should now completely understand very much that the priority of resilience of the economy is huge. External dependence, poor fiscal space, large debt are the biggest problems. How the economy can become healthier, more diversified, less dependent on outside are the big questions. Whether the local government now understands and knows the ways to address this problem, I don't know, and I don't think it's evident, but that is a problem. And finally, in terms of IR, international relations, this government should finally understand that Kyrgyzstan should become less aid-seeking and a less enemy-seeking country, trying to play geopolitics, at the same time trying to get some dividends from other countries, but rather become reliable, trustworthy, competent, and proactive partner for our international allies. We realize that the crises like pandemic are never won individually. It requires cooperation, partnership, and the Kyrgyz government faces this huge task of convincing that the government can work with foreign partners and be a reliable partner, and not necessarily the one that is a burden on other countries' taxpayers. So these are summary of the key chapters of this study. Many parts are tentative, things are developing, so we will have to update. Here I finish, and if there are any questions, I'll be very happy to address them. Thank you.
Thank you very much, Shairbek, for this really interesting and very in-depth analysis. You've covered a whole range of topics, from government politics to society, economics, and also international politics. So I will try to revisit some of them with some questions. And also I want to invite the audience to just pose any questions in the Q&A box. What I found really interesting is your presentation with the excess deaths compared to the official number of COVID-19 deaths. What do you think is the reason? Are there any political interests behind it to keep the official numbers low, or is it just a lack of testing and diagnosis? Your mic is off.
Sorry. Yes, thank you very much. I asked this question to several doctors and people working in the system, how to explain this discrepancy. And obviously, there is no single explanation as to how to account for this phenomenon. Apparently, there are two or three main reasons. First, as people die, the protocols how to qualify a death was not consistently applied. We don't want to go too technical, but when a person dies, the person may have COVID, but also very evident health problems with heart or with diabetes. So doctors suggest that there was just inconsistent application, and when you qualify the death, which leads to differences in these numbers. There was in the society, there were huge arguments. At some point, there was a belief that in the conspiracy theory that the government is inflating COVID casualties in order to attract greater aid from outside. Then there was another alternative conspiracy theory saying that government is hiding real number of COVID in order not to sow the panic among the society. So, and I cannot cite the person, but one of the doctors suggested that every time before the major political events, such as elections, there was very deliberate lowering of the COVID figures in the weeks prior to elections. And so we had elections in October and another elections in January. And apparently that suggests that there was a political manipulation as well to kind of try to manage the public expectations or public demands, public reactions. But this is indeed very impressive discrepancy, which is not the case in the case of Europe, in case of East Asian countries.
Yeah, so clearly the mix of several factors playing a role too, which then leads to statistics that don't represent the reality very well. You also mentioned that politically it was quite some unstable times in Kyrgyzstan. You had a regime turnover, the change of several ministers, and you have mentioned the dissatisfaction of the people with the government. So clearly the idea that times of crisis benefit the incumbent government is not correct for Kyrgyzstan. But what do you think? What could or should the government has done better?
Well, probably that's too big question for us to not only answer, but even to have an idea what could have been done differently. But as we speak to different people, one thing was, of course, that the biggest mistake was the very strict lockdown in the early stage of pandemic. For many people suggest that the government started too early without proper preparation. Which basically resulted in exhausting the public tolerance for lockdown. The daily figures were like 2-3 persons of new cases of COVID, and everyone sitting at home. So it basically paid lip service. So people started distrusting the problem, so dismissing the COVID as a danger, and suggesting that government is just doing something else while using the coronavirus as a pretext. So that, I think, paid very bad service to the government, because at a later stage, when crisis really came in big scale, the government didn't have political resources to enforce similar measures again. But other than that, the Kyrgyz government faces very similar set of problems in any policy area, and that is called corruption. The government's inability to ensure the transparency and accountability was the biggest reason why public simply disobeyed the government regulations, and it's been a very chronic problem. And I think even though corruption doesn't directly explain the failures of the pandemic policies, it explains the degree to which the society a priori was not supportive of the government's measures, and why government eventually ended up being losing sight, not the kind of convincing and reliable partner or the protection for their citizens. Other than that, it is this economic poverty, the lack of resources that state had in its disposal, Of course, would be unfair to say that that's a mistake of the government. That's the reality of poor governments, poor states, or poor societies. When the crisis like this hits, these countries get inevitably damaged in a bigger scale compared to the countries that had fiscal space to kind of alleviate the burden of the pandemic on the society. That was simply not available in Kyrgyzstan. So combined with wrong policy decisions or kind of too late, too little decisions, I think this was probably the biggest kind of elephant in the room. That's the lack of or deficit limitations of economic resources in disposal.
Yeah. So now you have a new government. Do you think, are you optimistic? Do you think the new government will do a better job, or are you pessimistic, and do you think maybe even the pandemic will threaten the democracy in Kyrgyzstan? What is your assessment?
Well, that's an interesting question. Of course, the new government has not really convinced the population that it is going to be dramatically different from the previous government. It's still too early to say, but I think our new healthcare minister made headlines internationally already, claiming that he knows how to treat coronavirus by using the aconite route, kind of very risky form of traditional medicine, which would have huge side effects, and he was condemned by the medical community, by civil society in Kyrgyzstan for kind of discrediting medical system in general by claiming that he and his friend, the president, are preparing those kind of liquid form of that aconite and claiming that really helps with COVID. That was a huge blow, not contributing to rebuilding the trust of the public in the state again, of course. So I have very little confidence that the new government is going to be any different in the way how it addresses the COVID. Moreover, the new government came on the wave of the populist rhetoric, very much addressed against the international kind of investors. So, and very much in the spirit of populist nationalism, where the liberal values, liberal norms are easily discredited and dismissed as not belonging to Kyrgyz. So just this week, the parliament adopted 2 new laws or bills, one on manipulation of information, basically a bill that will result in curtailing the freedom of expression in Kyrgyzstan. This bill initially was adopted last June or July at the heat of the pandemic of the past year, but the president then vetoed it. Now the current president will most likely sign it, judging by the way how the parliament was given green light to adopt. And another law was on introducing greater inspections or requirements of reporting for non-governmental organizations, basically an attack against the civil society in a very naked form. So at the moment, I don't see that the new government is going to be very different in not only struggling with the pandemic effects, but also more generally in terms of rebuilding the trust. The values and norms of democracy are being eroded further, and so not much of positive change at the moment.
Yes, so clearly the government hasn't lived up to expectations and might not do so in the future. But you mentioned that society really stepped up, and there was a whole lot of community effort and volunteer work in order to fight the pandemic. How did the volunteers organize themselves then? Did they use a certain platform, or were they already organized as volunteers before it happened and then just stepped up? How did that happen all?
The volunteer movements emerged primarily through social media. As the pandemic started, when initially reports came because of the lockdown, different families were literally starving, running out of savings and so on. In Facebook, in WhatsApp, Telegram, the groups emerged saying that let's collect funds to support, basically prepare food packages and distribute among the population. That was the initial phase of the process. And as the hospitalizations went up in terms of numbers and the government really ran out of the resources, I think, as far as I remember, it was again social media serving as a platform for mobilization of these groups. How could we explain it? I think the roots really lie in the vibrant civil society that Kyrgyzstan has long had and really enjoyed having in the past several decades. If anyone checks or compares this virtual social media, social networks, there's a very huge difference between neighboring countries and Kyrgyzstan in terms of the level of activism or social activism among the population, including the younger generation. And this doesn't necessarily is not limited to so-called NGOs or kind of Western-funded grant-eating organizations, as the government usually says. It has been really kind of a grassroots movement. I witnessed very different groups in Russian cities, kind of labor migrants in Moscow, in Petersburg, and other cities, organizing among themselves to collect money and send to their hometowns to those who were found really vulnerable. So this is probably a result of the early liberalization of Kyrgyzstan, a result of the degree of civil society, plus general knowledge in Kyrgyzstan that we don't expect too much from the government, from the state. So the weakness of the state has not been novelty for us. And I think the population is relatively prepared to step in view that expectations from the state are low. And if you compare to Europe or to other developed countries, basically it has been the state deciding what to do, how to do, providing the resources, but also enforcing the measures. In Kyrgyzstan, neither resources, no enforcement. So it basically opens up the space for, or even requires participation of the civil society and just activists in general. So those were, I think, were the main prerequisites for this phenomenon.
Very interesting. We've also looked at already at other Asian countries in previous online seminars, and you've seen that in several other Asian countries, international relief organizations play a very big role now, and they receive a lot of funding to deal with the consequences of COVID and the economical damage. What role do international relief organizations play in Kyrgyzstan?
At the moment, it is really hard to come up with the very specific data, but as the pandemic started, Kyrgyzstan has become one of the countries really most actively seeking external help and really kind of embracing every organization willing to help. So on the website of the healthcare ministry, there's even the list of all organizations and individuals who provided or granted masks, equipment, and financial help. So in that sense, I think Kyrgyzstan is one of the countries that are indebted to international relief groups from financial institutions like IMF, World Bank, ADB, to more specific organizations like ICRC or Red Cross, and foreign governments, foreign embassies. There were very few partners of Kyrgyzstan, development partners of Kyrgyzstan, who didn't get involved in providing some form of assistance. And the only problem, of course, that the foreign governments themselves were under severe pressure. And so this was a situation unlike previous disasters in Kyrgyzstan. For example, I remember in 2010 when there was huge interethnic violence in Kyrgyzstan. The government gathered huge kind of donor conference, and the donors pledged literally kind of $1 billion or so of emergency help. This emergency, of course, was very different because United States, Europe, or Russia, all governments were themselves under severe pressure, and we couldn't expect the same level of commitment and same scale of help from outside. Nevertheless, we received as much as we could probably mobilize, and that was crucial to maintain the government's fiscal financial balance in the early stage when tax collection went down, businesses were shut down, salaries had to be paid, and everything was basically maintained thanks to the external aid.
Okay, thank you. We are now already reaching the end of today's seminar. Dr. Shairbek's article will be available for download very soon. I can highly recommend it. It's an excellent analysis. And please also sign up for our following seminars. In 2 weeks, we will be looking at Thailand's fight against COVID-19. And also, please feel free to stay in touch with us via our email address, asia@hss.de. Via this address, you can also sign up to our newsletters in the South and Southeast Asia division, as well as the Northeast and Central Asia division, asia@hss.de. And with that, I would like to thank Dr. Shairbek for his fantastic input today, our organization team behind the scenes, and last but not least, of course, everybody who signed up today. Thank you very much. When you sign out now, you will see a very short survey, so please fill it in and help us improve our future seminars. And with that, thank you, goodbye, and
thank you. Goodbye.
See you in 2 weeks.